Assalamu alaikum. My name is Saleha and I belong to the Department of BS Biotechnology. Today I had to discuss about the angiotensin converting enzyme inhibitors and angiotensin receptor blockers. This is second part of my presentation. As I discussed earlier, emerging applications of AC inhibitors and ARBs. First one is cancer, second neurological disorders, and third one is viral infection. Cancer. Anti-tumor effects. Preclinical studies have shown that ACE inhibitors and ARBs may have direct anti-tumor effects by inhibiting angiogenesis, reducing tumor growth, and preventing metastasis. Potentiation of cancer therapies. Some evidence suggests that ACE inhibitors and ARBs may enhance the effectiveness of certain cancer therapies, such as chemotherapy and immunotherapy, by improving drug delivery and modulating the immune response. ACE inhibitors in cancer. Here are a few proposed mechanisms by which ACE inhibitors may exert potential anti-cancer effects. Inhibition of angiogenesis. Angiogenesis is the process by which new blood vessels are formed and it plays a crucial role in tumor growth and metastasis. ACE inhibitors have been found to inhibit the formation of new blood vessels by interfering with the production of certain growth factors involved in angiogenesis, such as vascular endothelial growth factor. By suppressing angiogenesis, ACE inhibitors may help to limit the tumor growth and prevent the supply of nutrients to cancer cells. Induction of apoptosis. Apoptosis or programmed cell death is a natural process that eliminates damaged or abnormal cells from the body. AC inhibitors have been shown to promote apoptosis in cancer cells through various mechanisms, including the modulation of signaling pathways involved in cell survival and apoptosis regulation. Immune modulation. AC inhibitors may have immunomodulatory effects, meaning they can influence the immune system's response to cancer cells. Some studies suggest that AC inhibitors can enhance immune surveillance and promote an anti-tumor immune response. They may affect the production of certain cytokines and immune cells, which can play a role in tumor growth and metastasis. Inhibition of metalloproteinases. Metalloproteinases are enzymes involved in the breakdown of extracellular matrix, a network of proteins that provide structural support to tissues. Increased activity of metalloproteinases can facilitate tumor invasion and metastasis. ACE inhibitors have been found to inhibit the activity of certain metalloproteinases, potentially impeding tumor progression and metastasis. For example, captopril, enalapril, lisinopril, ramipril, perindopril, and unipril. Second, neurological disorders. Alzheimer's disease. ACE inhibitors and ARBs have shown promise in preclinical studies for the treatment of Alzheimer's disease. They can help to reduce neuroinflammation, protect against amyloid beta deposition, and improve cognitive function. Second, Parkinson's disease. Limited evidence suggests that ACE inhibitors and ARBs may have neuroprotective effects in Parkinson's disease by reducing oxidative stress, inflammation, and neural death. ACE inhibitors in Alzheimer's disease. Vascular effects. Hypertension and vascular dysfunction have been linked to an increased risk of Alzheimer's disease. ACE inhibitors, by reducing blood pressure and improving vascular function, may help to maintain adequate cerebral blood flow and oxygenation, potentially protection against vascular damage in the brain. Modulation of the renin-angiotensin system means RAS. The RAS, besides its role in blood pressure regulation, is involved in various physiological processes in the brain. There is evidence to suggest that dysregulation of the renin-angiotensin system may contribute to the pathogenesis of Alzheimer's disease. ACE inhibitors can modulate the renin-angiotensin system by reducing the production of angiotensin II, which may have neuroprotective effects, including the reduction of beta amyloid production and deposition, a hallmark of Alzheimer's disease. Cognitive effects. Some studies have suggested that AC inhibitors may have direct cognitive benefits in individuals with Alzheimer's disease. These cognitive effects may be related to improved cerebral blood flow, reduced vascular damage, and enhanced neuroprotective mechanisms. However, the evidence regarding the cognitive effects of AC inhibitors in Alzheimer's disease is still limited and requires further researches. Third one is viral infections. Some studies suggest that AC inhibitors and ARBs may have antiviral properties against other viral infections, such as human immunodeficiency virus means HIV and hepatitis C virus HCV. However, further research is needed to establish their efficacy and mechanism of action. Potential cardiovascular benefits. In some cases, viral infections can lead to cardiovascular complications, especially in individuals with pre-existing cardiovascular conditions. AC inhibitors, by reducing blood pressure and inhibiting the effects of angiotensin 2, may have cardiovascular protective effects. These benefits are particularly relevant in the context of certain respiratory viruses, such as SARS-CoV-2, which can affect the cardiovascular system. Effects on inflammation and cytokine response. Viral infections, including respiratory viruses, can trigger an inflammatory response in the body. AC inhibitors can modulate this inflammatory response by reducing the production of certain pro-inflammatory cytokines. However, the specific effects of AC inhibitors on the immune response to viral infections are still being studied, and their impact on the outcomes of viral infections in air unclear.